afternoon. I'm Stephanie Carter Kelly, a physical therapist who uses yoga in just about everything I do. And so today I'm going to talk to you about trauma. A little heavy for Friday afternoon, but I trust me, I'll bring it back around, and there's a lot of positive in dealing with trauma. So if you have chronic pain, you may have a history of trauma. So let's talk first about what is trauma. Because when I first started looking at trauma as a reason for maybe why I had pain, I thought it was not me. I really only thought of trauma as PTSD or victims of sexual or physical abuse. But I learned through some research that trauma can be the result of just one instance of shaming. It can be ongoing criticism. It can be bullying. It can be neglect. So what is really important is the perception. And also, if in denial after trauma, the symptoms that are consistent with holding on to trauma, one of which is pain. So first, let's define trauma. Trauma is the response to a deeply distressing or disturbing event. And the emotions that come with trauma are scared, isolated, helpless, shocked, stunned, hurt, injured. It could be an injury, an accident. But what it really does is it diminishes a person's ability to cope and feel the full range of emotions and experiences. More and more, we're really understanding the role of trauma in health and wellness. The Center for Disease Control did a study on adverse childhood experiences, and there's a correlation between adverse child experiences and long-term health consequences. So I needed to finally acknowledge my trauma because I denied it for many years. But I really had to be ready to acknowledge it. I had kind of peeked at it a few times over the years, but I denied that it had anything to do with me, or any of my issues. I kind of denied that I even had symptoms, and that pain was a symptom. I thought there were really physical reasons for my pain. But the trauma that I experienced occurred in the early days following my birth. So if you've ever looked at my website, you may know that I was adopted as an infant. So the first 18 days of my life, I lived in a hospital nursery, I think, and I'm pretty sure I cried. I know that my basic needs were met, but my forever mom told me that she was told that I cried a lot, and the nurses did their best to try to hold me as much as possible. But when I got home, I also cried. And, my mom told me when I had my kids that she was told by her pediatrician and by the popular book of the day, the Dr. Spock book, that kids were supposed to cry it out. And she told me that she didn't really like that advice. And when my kids cried, Grandma said, go get your kid and comfort them. But the crying it out of the day when I was born was very popular. And I do believe that led to sort of continue that experience, that birth trauma, of not having the comfort of my biological mother early on. I think that trauma just sort of continued for several months after I was born. And that trauma played out in not being heard and not being comforted when I was in distress. And I really denied the trauma for years because it put the burden of blame on the process of adoption and on both my biological and my forever parents. And if anybody knows my forever parents, that was a blessing. So acknowledging that as a trauma sort of denied that I had this amazing blessing in my life. But now I really can acknowledge both of those, that one doesn't negate the other. I can have both that trauma of birth and what I lived with, but also have the blessing of being in a wonderful home growing up. I know that everybody at the time was doing the best that they could. So how did I finally acknowledge this as some of the reason why I have chronic pain? So some of this was in learning more about chronic pain and knowing that there were more than just physical reasons for the pain that I felt. So as I developed a practice of awareness with mindfulness and of meditation, I had to train myself to quiet my brain, quiet that chatter that goes on constantly. And I had to really learn to listen to my inner voice. So in that awareness, some of the training in mindfulness is also to be very curious. And so I got curious about the sensations of my body and how those sensations directly related to any emotion that I was feeling. So I began to recognize that not being heard was a really big trigger for me and for my nervous system. And this became evident one morning after an argument with my husband, normal argument between, married couples. I felt really hurt and mad that I wasn't heard. Maybe my opinions were shut down. So I left the room, went to take a shower, and something about running water really gives me a lot of clarity. So as I calmed down, I was not running the argument through my head. I was in that curious mode. Like, why is this bothering me so bad? Like, why? And I heard that small little voice, that deep voice say very clearly, your cries were not heard. Your cries were not heard. And my mind went back to that small little infant crying uncontrollably in a bassinet. And I realized that infant was me. And because of this trauma, I really needed people to acknowledge me. I need to be heard. I need to, make sure that I'm heard. That's what gives me comfort. And when I feel as though I'm not being heard or acknowledged, it triggers me. It triggers my nervous system and it gives me pain, a lot of pain in my neck. And the years, the result of a whole life of not really understanding trauma in my life gave me years of stress and tension in my back and my neck. I can look back over jobs that I left because of the stress of not being heard. Times when I felt like I questioned my value in those jobs. I've felt stress in relationships, in dealing with communicating in a way to feel like I'm being heard. Part of it is perception. It's not necessarily that I am heard. It's whether or not I feel as though I'm being heard. So recognizing my birth and the trauma around my birth as that root cause of discomfort became a game changer for me. And it's not the reason to say, oh, that's just how I am. I'm just going to be that way. It's more of a reason to work at making small changes in how I both communicate and also how I perceive communication from others in relationships, and not to run away when I feel that stress. When I first have that sense that I'm not being heard or acknowledged, to not just shut down and run away. But I also have to tell you that there have been benefits of this trauma in my life. And one of the things is that I can do this. I can talk to people. I can teach. I can be in front of large groups. I've trained myself to be able to speak in a way that I feel like, that there's value. Oops, sorry, that was my little dog. That there's value in what I hear or in what I'm saying. I make sure that I'm trying to bring value to discussions. So there's both negative and positive to to the trauma in your life. So I want to make sure that you're looking not only at trauma as how it brings the negative in your life, but realizing that you've had to overcome it. So there's some strength to that, and building that strength has been important for you in your life. So I keep working on that awareness of how trauma and how that shows up in my life. I keep trying to bring these deep-seated emotions and reasons for my pain to the forefront. So I'm continue to be on that quest. And it took me a while to do this. So in sharing my story, my hope is that you can see some of yourself in the story, and that it might help you accelerate the process, and get ahead of those layers and layers of tension that we put onto ourselves, get ahead of it, get in front of it, so that you can start reversing that. So thanks for joining me this afternoon. And if there's any more that you want to learn about my experience of dealing with pain, or how I'm trying to help others, I have yoga videos, I have blogs and other educational videos on YouTube to try to really bridge both that mind and body experience of pain, how the brain perceives pain, how the body perceives pain. So thanks for joining me. Stephanie Carter Kelly, yoga physical therapist. Have a great day.